Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Moreno. A new study found the rate of Hispanic people killed by law enforcement officers has jumped dramatically from 2010 to 2020. Joining us to share more about this study he co-authored is Jagdish Khubchandani, a professor of public health at New Mexico State University. Jagdish, it's great to have you back on the program.
Well, thank you for having me.
I'd like to start off learning a little bit about this study. You examined data from the years of 2010 to 2020. Can you share with us what type of data you looked at?
So we looked at the CDC death files, and those are official records of death that come to CDC for processing. And we classified deaths by type of death, mechanism of death, who died, race, age, gender, and region in the United States. So I've refined by police killings of Hispanic people, all age groups, across the nation, and those are the death files we analyzed.
Now, can you give us an understanding of just how much that rate rose between 2010 and 2020?
So the rate of killings by police of Hispanic people increased by 40%. It was not a linear increase, but on an average, every year, 4% increase. But the population of Hispanics grew by 18 to 20%. So we do see some disproportionate amount of deaths among Hispanics by police officers.
Okay, so let's talk a little bit about the demographics that you looked at. Can you kind of share with us where this seems to be happening the most?
In terms of region, I think we could focus on Western United States. So the highest number of deaths happened in California. Second is Texas, because those are two big states. But then we compute by the population density based on 100,000 people, and New Mexico starts ranking number one in the nation on police deaths of Hispanic people.
Now, with these deaths, how much was a firearm used?
Vast majority of the people who are killed by the police, Hispanic people, are killed because they are shot by a gun. 90% of all these deaths by police have happened due to a gun.
Now, what age groups seem to be the most prevalent when this was where this is happening?
Yeah, I think that's the most disconcerting finding, that it's vast majority males and 20 to 39 years of age, which led to thousands and thousands of years of life lost that they could have lived.
Now, according to this data, if you're a Hispanic male between the ages of 20 to 39, you live in the Western U.S., what is your risk of being killed by law enforcement?
1 in 100,000, easily.
Wow. What regions seem to be the lowest in this category?
In the Northeast seems to be much safer for Hispanic people in terms of police deaths. The Midwest is okay. I think it's the western part in the southern United States where we have a lot of police killings of Hispanic people.
So how much has racial inequality really kind of shown itself within this data? Can you share about that?
Yeah, there are other estimates suggesting that it's because of poverty, lack of education, drug-related crimes, mental health emergencies that the police officers have to deal with, where they end up shooting and killing people. And that shows up because Western United States, part of it, the border region, has gross health inequities that show up in these deaths.
Now, when we're talking about those health inequities, what are some of the things we're talking about?
Drug use, mental health situations that are not addressed, poor mental health care, lack of education, employment issues. So, crime as is a function of socioeconomic climate as well. And that's why we see these deaths mostly focused here in the border region, Mountain West. Unfortunately, New Mexico ranks number one in the nation.
Let's talk about those issues a little bit. You brought up drug use. I don't think it's any secret to our audience that that's a major issue here in our state. Can you give us an understanding of just how much of an issue is it in New Mexico, but then across the West?
Yeah, I think most police killings of Hispanic people that you see in this area, almost in half of the cases, it was drug use related crime, or the person was being chased by police and then they were killed. And that tells you that this does not happen a lot in Northeast, for example. And so, yes, mental health problems and drug use clearly showcase more in this. And the overall picture of highest number of suicides in the border area, highest number of homicides nationwide happen in this region tells us volumes about how we need to fix the social aspects of the society and the mental health issues that prevail around here.
Now, when you're talking about mental health concerns, what are some of the things that really stand out with the data you looked at?
You know, the CDC death files do not give us those pieces of information on mental health issues and such. But yes, mental health plays a big part. Other estimates have shown. A classic case is Amelia Baca in Las Cruces, a 75-year-old lady who was having a mental health crisis, was having a knife in her hand, and the police officer shoots her a bunch of times as a responder, which I think was maybe unwarranted.
Now, there's certainly been a lot of conversations about that and how the city is planning on responding to it. That conversation's still ongoing. Of course, there is a program in the works to help address issues like that. We'll see how that develops. But I'd like to also talk about another issue you brought up, economics. It seemed to play a role in this as well. You talk about the economic inequality that exists here in the West, in New Mexico. Can you kind of give us an understanding of that?
Yeah, you know, many people who are killed by the police or commit suicide don't have college education, don't have stable employment, frequently engage in crime and drug use, and also have mental health situations, which is more pronounced here. And that's why we wrote in the study that this needs a comprehensive approach. A police officer does not have to respond to mental health emergencies, for example. And there are more, things to be done with preventing crime and reducing drug use in this area.
As you were looking through this CDC data, was there anything alarming that kind of stood out to you?
I think the alarming fact was New Mexico ranking #1. And then the focus here, like Nevada is #2, Colorado #3, close #2 and 3. So the whole area of Mountain West, Nevada, Colorado, New Mexico, Arizona, despite the fact that we adjust by the population of Hispanics, the rate of death is the highest in this region, is alarming to me. And what we have suggested is from the CDC death files, but the other open source data suggests that we are underestimating deaths by half. So the real number of Hispanics killed by police nationwide could be more than 2,000.
So you're saying that there seems to be perhaps a problem with the way the data is being collected?
Yeah, because a police officer also works with the coroner or the physician who's reporting the death or writing the death certificate, and that's where the misclassification occurs. We have said 1,100 Hispanics were killed by police in the last decade. The Washington Post database suggests 2,000. It's because of misclassification. You could label a death as unintentional or homicide or unknown, and that's where the misclassification happens.
Wow, that certainly, I would imagine, would be very concerning to folks who are trying to understand this problem in order to address it.
Yeah.
There are some areas that you mentioned that this doesn't seem to be as big of a problem as it is in the Western United States, in the Southern United States. What are some things that are perhaps happening different in those areas where this isn't a problem?
There's better economies, better mental health care, more drug control, and better training of police and police evaluation systems. Like many cities now have a triage system where in a mental health emergency, they don't have a police officer responding, which I think Las Cruces is trying to do. And those are things, places in Northeast they have done and had a good control on police killings of citizens.
Now, there's conversations happening in Las Cruces about the potential of establishing a citizen police oversight committee. Did you come across any of that in your research about communities that perhaps have implemented that?
There are some communities that have done those things, but there's no research to show those are effective things to do. But it would make some sense that there has to be greater collaboration between police and citizens, have a system of crisis response versus crime response. So I think Las Cruces, New Mexico is headed in the right direction. We just need to see how we can do better and understand the issues police officers face and citizens face. For example, here, a 20-year-old can be trained for some time and deployed as a police officer. Maybe that needs to change some, and we need to do better at hiring, like we wrote in the study, more full-time, female, college-educated officers who have the emotional maturity, the training on crisis resolution, and those are practices to be implemented in the future.
Now you mentioned, obviously there seems to be an issue with hiring the right police officers. Why so? What does the data tell us?
It's a shortage nationwide, and then even police officers don't get paid well. Their life is on the line, and then I think some of it is more about the reputation that we have given them. In my study is not about blame the police, blame the citizen. No, how do we come together and solve this problem?
Now, you obviously were looking at data from the CDC with this study and other studies. Did you come across any data that was offering feedback from law enforcement officers about these situations?
No, there's not been much on that. Even to the CDC death file on who was killed is available, but who killed them is not available. Was it a male police officer, female police officer, college educated? We need those demographics to help understand who is more likely to kill a citizen.
Now, improving that transparency when it comes to these numbers, how could that help us understand this issue so much more?
Yeah, like the CDC has death files, and it's the police officer reporting that they killed someone, then they go report to their own unit, or the coroner physician who work with them. Maybe there needs to be oversight on who's reporting and how is it being reported. And not even just deaths. Every time a police officer shoots someone, should be reported in some database. And given that lack of data, Mapping Police Violence, Washington Post, Guardian, 5 different data sources have emerged in the last 5-6 years. And they're independently reporting on what happened every day, real time.
Now, communities across the country have certainly tried to work towards other programs that perhaps send trained civilians to respond to some of these calls and issues. What do we know so far with those programs, and are they having success?
Yeah, and worldwide there are programs like body cameras being worn in Canada and now in United States, and then having a team of responders is helping a lot deal with some of these mental health emergencies. But the question remains, how many resources does a county have to have these kinds of triage programs and referral systems and have the know-how of what kind of emergencies should be dealt by who? So it's a resource issue, but we can also be efficient. We have social work program in NMSU. We have students who need internship experiences. They could be deployed.
What else do we know about using less lethal means when it comes to addressing these issues? Obviously, there's programs that send trained civilians out. We have crisis triage centers. Anything else out there?
Yeah, and in other countries, like if you look at Western industrialized nations, United States is among the top 5 nations with number of police killings. And that doesn't happen in many industrialized nations. So they are doing certain things like building greater trust, providing more training to police officers. Our training hours need to be revisited, and then having a fair representation of male and female police officers, and a number of other things that can be done.
So if we watch television today, and when it comes to this issue, it seems like every week we're seeing a high-profile shooting that may occur where somebody is killed. Can you share with us a little bit about how perhaps the media may portray these issues? Because a lot of times when we think about this issue, maybe we think about it as a white and black issue when it comes to race. But what you're sharing with us seems to be like a bigger issue than just that.
Yeah, it is a global issue. I've lived in India for most of my life, and police killing is a big issue in India. I think from the pandemic, there was a fallout from the pandemic. too much of economic upheaval leading to more crime in the society, shortage of police officers, people becoming more aggressive. So it's a global thing, and yes, it has continued to increase as our study has shown. 2020, of all the years from 2010 to 2020, was the deadliest year for Hispanic killings by police. So from 2020 to 2021, 22, things have not gone well between civilians and the police officers. And there has been a lot of tension and distress overall in the society with economy, crime, politics, and that the reflection of what we see is here.
Now, is there any place in the Western United States where there is a predominant Hispanic population where this isn't an issue? Were you able to come across anything where perhaps there's some communities that seem to not have a problem with this?
Yeah, states like Oregon, Washington are a few states where they don't have this kind of a huge problem.
Okay.
So,
now, I mean, there's so many issues that could be tied up with this, but you also have a cultural issue. There could be a language barrier. There could be other certain things in the way of communication. What are some of those barriers that may exist?
Yeah, the cultural and language barriers. Like I lived in the Midwest for the last decade, and anytime I got a citation, my citation read my name and I was a Hispanic for the police officer. Because most police officers in the Midwest where I lived were white men, and they didn't know the difference between an Asian and Hispanic. So those things do happen frequently. And then the training of a police officer on a mental health crisis. Is a person threat to someone else, themselves? Should they be shot? Is another barrier. And here in this area, language. Like, I don't know how much Emilia Baca knew about English, the lady who was shot and killed. And many other people have those issues when they are in a mental health crisis, but they don't know what to say about it in English.
How much of this really comes down to perhaps the way policing is happening in the United States today? If you look back maybe 50 years ago, an officer on patrol may have had to get to know the community they lived in. Can you kind of share with us a little bit about how the change in policing over the last couple of decades may be affecting this?
Yeah, I think that we wrote in the study that the mission is to protect and serve, but now it's become a crime-fighting mission. And oftentimes they are put in a flight and fight situation worldwide. It does seem like policing has changed. Civilian distrust has increased in police. And then we have had high-profile cases like George Floyd within the past 3 years that has created a global movement that police have become more brutal. So policing has changed, yes.
If policymakers in New Mexico and at the federal level were taking a look at your study, what are some of the things that you would invite them to really focus on?
You know, we can take lessons from some other Western countries that don't have this major issue. The training has to be revisited. Training on conflict resolution, mental health crises, bringing in more full-time college-educated officers, females, looking at their pay scale and incentives for police officers, and also some citizen training on how do you encounter a police officer, what's the good behavior. And those are some things that other countries have done and had success.
Do you hope this study will get the conversation talking about why it isn't being brought up enough in the media about the number of Latinos getting killed by law enforcement?
Yeah, I think that was also a reason to conduct this study. After the death of Mr. George Floyd, the whole idea was that African Americans are the most likely to be killed by police in the United States. Even last week, an 11-year-old African American boy was shot by the police. But because we look at who's most likely to be killed, we forget who's close second to be killed by a police officer is Hispanic young males. And that's why we did this study, to understand, is it just an African American people's thing, or it also engages Hispanics at the same rate with police killings? And we found that Hispanics are the second most likely to be killed by police, a close second.
Now, you mentioned obviously some reasons why you wanted to conduct this study. This is an issue you've been examining for some time. Can you give us a little bit of history of the research you've done even before this with this issue?
My thesis in the PhD program dealt with domestic violence. And then since then, it has been more about violence and crime and drug use, mental health. This time, for police killings, we wanted to ascertain that what is happening with other racial groups in relation to police killings. So I've enjoyed the type of research we do worldwide. The problem is the way people perceive it. Political, social, immigration, race. I'm not race baiting. I'm not trying to make a statement. I'm just showcasing the data of deaths among Hispanics. My last study looked at suicides among Hispanics, that they're not frequently a part of this discussion of suicide in America. And so I'm hoping that I'll be more data-driven and keep finding more truth and information, and hopefully people will know that this is not about making a political statement or defunding the police. It's about creating a better society.
How do you have that conversation with people, though? Because this issue seems to really charge folks, and they go into different sides and have strong opinions on this issue. So how do you have that conversation with folks to let them know that this is a public health concern?
Yeah, and that's an artificial dichotomy that they have, and many in my field have, that why are you looking at this? We are supposed to deal with obesity, HIV. No, I'm looking at death and disability. And in the general public, I just tell them about the numbers. Has gun violence increased in the United States? Yes. 45,000 people will die this year of gun violence. Has police killing increased? Yes, the CDC death files show that. And once you present that data, then they can argue the way they want to. I'm just showing them the truth, that we have a serious gun violence crisis in this nation that no other industrialized nation has.
You've talked about, the growing concern about firearm deaths in the United States. I mean, and even how it's impacting our young people. Yeah. Can you kind of give us an understanding of that?
Yeah, I mean, we have more guns in the society today than people. We have 340 some people in the country, but more guns. And 45,000 people will die this year of guns. Sadly, the majority will be suicides. So gun violence as an issue is always a charged issue, but many people don't realize it's the suicides that are killing people. Number 2 is homicides. And suicide is an area where we can make a difference if we solve our drug crises, mental health crises, by resource-efficient methods. And young people, especially today, as you were asking, have lived in unusual times. This is a strange time for our college graduates. They have had remote education. They don't know where they will be headed next. They have had food insecurity, depression and anxiety. And many of them then end up killing themselves. And it's becoming a global thing with more social media use, more insecurity.
Okay, Jagdish Khubchandani is a professor of public health at New Mexico State University. Jagdish, I want to thank you so much for stopping by to talk with us about this important issue. We now bring you a profile of a local organization that teaches people to appreciate the uniqueness of the ukulele. Our producer, Christian Valle, shares more about the group Las Cruces Ukes and this community connection.
Waiting for me, Santa Catalina, the island of romance.
We want to have people exposed to ukulele music and to find out that ukulele music isn't just for Hawaiian music and it isn't just Tiny Tim. You can play any genre of music with the ukulele. The ukulele is a great instrument for people who want to play something fun, and the other thing that's really appealing about the ukulele is that, like us, many people play it in groups. But it's a fun, easy instrument. There are only 4 strings. You have 4 fingers. Our goal is to bring the love and fun of the ukulele to as many people as we can, either by helping teach them to play the ukulele or by performing out in the community. So we have 2 different adult groups, a performance group and a Strum for Fun group. We have a kids club and we have a teen club, and we have performed about 77 times since the group formed.
It's just a great social thing, really. I mean, that's really what I do it for. Other people, the group has different levels. There's people who are trying to learn techniques. Some people are trying to improve their vocals. I'm the person who I think represents the one who's just doing it for fun. So if I improve over time, great. That's not my goal. It's not a job I gave myself to do. If I play well enough to play in the group, that's all I want to do. So that's the kind of level that I like to work at.
The ukulele festivals are such a big draw for ukulele players, and they're such a great way to meet other ukulele players and to be able to refine your skills and pick up techniques from instructors who travel the country and the world teaching ukulele workshops. So why not come learn from the best right here in Las Cruces? You can learn more about Las Cruces Ukes, first of all, by going to lascrucesukes.com, all one word, and Ukes is U-K-E-S. And it tells all about our adult practices, our kids groups, and you can also go to our Las Cruces Ukes Facebook page. I want us always to be there to help brand new players, to have something to offer for more advanced players, and to have something for kids and young people, because it is something that can bring joy to the heart of anybody of any age.
That's it for this week's program. Remember, you can visit our website, krwg.org, to keep updated with the latest news. I'm Anthony Moreno. We'll see you next time.